if yeah, welcome to Yellow Belt training. If I can, I see around So everyone, yeah. If you can just please participate in these polls, please. And anyone who wants to unmute also, they can also talk, but I'll try to, I think I'll suggest that better in the beginning, we can listen and learn something, and after that, we'll be happy to take your questions. Yeah. So welcome everyone, and those who have just joined in, if you can participate in the polls, please. So which department you are associated with right now? And also, if you can tell me, also in the chat box, you can write which country you are from. Where are you residing at this point of time? So I know that we are now conducting this session in different time zones, but yeah. Okay, great. Thanks for answering these questions. Okay, so Ramya, you're from Australia, Uma from India, Qatar. Okay, you're from Qatar, Nisreen. Okay, great. It's a little early there, right? Yeah, Australia, Amit, you're from Amit, yes, hi. And Mehnaz, also you're from Australia. So okay, great. Okay, so great. Thanks for answering these questions. Okay. Dr. Hari Krishnan. Okay, great. Welcome. You are in UK right now. Okay. Great. Welcome to Yellow Belt training.
Sorry to interrupt.
You can only stay ahead of competition by putting your best foot forward and by enhancing your skill set. Similarly, organizations need to put their best quality forward in order to stay ahead of competition, be it in terms of products or services or customer satisfaction. In today's training, that is exactly what we are going to do. Lean and Six Sigma Yellow Belt will show you the importance of Lean and Six Sigma in both your personal and professional life, and will set a strong foundation for further levels. In this 2-hour session, you will learn about the tools and techniques that Lean and Six Sigma Black Belt use, some concepts of Lean and Six Sigma, real-time projects, and how Lean Six Sigma is applied to them, and a lot more. We are sure that after this training, you will see the world with a fresh pair of eyes. Join us in this Yellow Belt session and become well versed in the foundation elements of Lean and Six Sigma methods. Become capable of assisting and improving processes. Improve your skill sets to become a part of the team focusing on complex improvement projects led by green or black belts. Apply DMAIC, DMAC in your work and push your boundaries to do better in every process you are part of. Once again, welcome to Anexas Yellow Belt training. I have designed this training based on my 32 years of experience in the industries, both in manufacturing and services. So once again, welcome to the Yellow Belt training. Okay, so thanks for participating in the polls, and now let us begin our journey. And See, Lean Six Sigma is not about only learning, but it is also about applying. So whatever you have learned, you have to apply. Because if you have learned some tools and techniques, if they are of no use to your hospital or a clinic, it is of we consider in Lean such knowledge as waste. A knowledge which is not useful to either you or to the society or to the industry is considered as waste. Anyway, we learned a lot about waste, etc. Okay, great. Thanks again. The agenda of this training would be, first I'll introduce a little bit about myself. I'll introduce myself, and also I will then introduce you to the company, and then we'll talk about Lean and Six Sigma benefits. Then we'll introduce you to Lean and Six Sigma, and then we'll talk about DMAC in healthcare, and we'll do a project. So what is the difference between process and a project? Process is something which is repetitive in nature, something which you keep on doing again and again, like traveling to your office is a process, because you're doing this again and again every time. You're trying to follow the same steps, almost same steps every time. There is a process. And what is the project? Project is a one-time endeavor. It happens only once. You can say it happens. It takes place, or it's an endeavor which is which has got a starting point and an end point. It doesn't exist after some time. So what we are doing in Lean and Six Sigma is we are trying to improve a process using a project approach. And we follow DMAC methodology. So I'll take you through the DMAC, and then I will take you through some of the applications in healthcare industry. And a very formal welcome, as I see people are still joining in. So we give some time for everyone to join in. Apart from Lean and Six Sigma, we also conduct CPHQ trainings. We also conduct PMP trainings, and a little bit about a formal welcome. Hi, welcome to Anexas. Anexas has been consulting and training the professionals in the organizations around the world since 2006, and we have trained more than 150,000 people and consulted for more than 500 organizations, which includes Fortune 100 organizations too. I'm Amitabh Saxena, and I have designed this program based on my 30 years of experience while working in various industries across many domains. The whole Anexas team once again joins me in welcoming you. Okay, great. Thank you. And yeah, so I was telling that if you can tell me from which country you have joined in, so that will give me an idea. And right now I'm in Australia, and I'm conducting this training program. And over the last 20 years, we were established in 2006 as a company. And over the last 20 years, we have trained more than 150,000 people around the world. I'm a chemical engineer, MBA Finance.
Hello.
Hello, yeah. I think, can we mute everyone, please? Yeah. So, yeah, so I'm a chemical engineer, also amateur poet, very hardworking. I completed my black belt certification long time ago, around 30 years ago. And then after that, I decided that I would like to become a Lean and Six Sigma full-time master black belt. I'll tell you what does it mean in a short while. I'm also a data scientist, PMP, CPHQ, etc. And I have also completed more than 1,000 projects in hospital or healthcare industry, apart from other domains in banking and manufacturing, etc. And you too can achieve much more. And today, you are not going to learn only from my experience, but also from what my students have achieved. Some photographs just to prove that I have been doing these training programs for the last 30 years for various companies. Yeah, these are some of the photographs I just wanted to show, just to prove that, yeah, so these are some of the things. Appeared on TV shows also, and in Gulf and in India. American Society of Quality, I have... On 21st of May 2019, I'm going to speak more than 10 times, etc. So let's say, I'll just move forward. I have got lots of hospitals, National Healthcare Services in UK. We have done projects for almost 7 years, and we have trained more than 250 green bills and black bill projects in National Healthcare Service in UK. I've got great videos about them. Maybe towards the end, I'll show you some of those videos. Okay, so now let us look at what are the benefits of Lean and Six Sigma. So Lean and Six Sigma can reduce your cycle times, it can reduce your costs, it can reduce the errors, defects, reduce the waste, reduce the rework, reduce the cycle times, it can improve your quality, production efficiency, productivity, customer satisfaction, patient satisfaction, capacity, and profitability. And which CEO would not love a person who can achieve all these things? So the green belts and black belts are the ones who can deliver all these benefits to the organization. Okay, so let us understand. Let's try to understand if you ask me in just one sentence, if tell me what is Lean and Six Sigma. So I would say that Lean and Six Sigma is a project approach towards process improvement. And just now I told you what is a process and what is a project. So patient treatment is a process. Project would be the OPD waiting time of our patients is 30 minutes. Presently, it is 30 minutes. And we would like to reduce these 30 minutes to less than 15 minutes. So this becomes a project. So we would like to reduce this patient waiting time from 30 minutes to 15 minutes in the next 3 months. So it's a smart project, smart objective with a smart objective, specific, measurable, achievable, relevant, and time-bound. And with that, you create a project charter, and with the help of a team, this could be a cross-functional team, you deliver a project. So an improvement project is always in a process. Obviously, it leads to improvement of patient satisfaction. Not only that, it also satisfies the government, other stakeholders, shareholders too, and it's a win-win strategy for almost all organizations. So now let us look at what do we mean by Lean and what do we mean by Six Sigma. Now, before we go there, what I will try to make it a little simple, and I could see most of you are totally new to Six Sigma, and now let me assume that we are starting from ground zero. So if we start from ground zero, then let me make a model of any hospital, any clinic, or any organization in the world, because I see some of the people are also joining from other industries also. So right now this program is focused on the Lean and Six Sigma in healthcare. But and in the chat box, can you please just write in the chat box? It will give me an idea. Are you from healthcare or which domain you are from? So this will give me an idea. Then if I see that lots of people are also from other industries, I'll try to take very few examples towards the end from other industries as well. But this training program is right now focused on Lean and Six Sigma in healthcare. Okay, great. So I can see that, okay, most of you who have written is, okay, healthcare, that's great. Okay, physiotherapist, okay, great, almost. Okay, very few are not from healthcare, so I'll restrict myself to healthcare industry. Okay, great. Thanks for that. And I hope everyone has, thank you, Ruth, Jocelyn, Haider, Gul, Uma, Vaughn, yeah. Okay, great. Thank you. Okay, great. Now let us create, now I'm going to draw a model of any organization. And think about your organization, or you can think about your department as well. Every organization has got certain inputs. Okay. These inputs are transformed through a series of steps. It could be through a series of departments, department A, B, C, D, or it could be process steps as well. And you produce an output. The output is either a product or a service. And my team and also others, they can tell me in case my voice is clear or not. If there is some issue in the internet connection, etc., just let me know in case there is. If I need to, if I need to speak loudly. Oh, it was a working day today, so that is why maybe I may sound a little low in my energy. Yes, but excuse me for that. Okay, great. So outputs. Outputs are consumed by the customers. Now, customers could be the patients, family of the patients, physicians, nurses, shareholders of the hospital, if it's a private hospital, or government. See, all of them are customers. So the outputs are consumed by the customers. And the suppliers supply the inputs. I hope you are with me till now. Yeah. So suppliers are supplying the inputs. Then we have got series of process steps. So I will write this as a process. Then we have output. Then we have customers. And the customers, they give feedback. Feedback about our services or the products. And also we predict the demand of our services and product. And a strategy department or a planning department would analyze that and inform the suppliers to supply the inputs accordingly, as well as inform the departments or the process steps to adjust the operating parameters. So this is how every organization operates. Dr. Deming called this as a systems map. This is how every system operates. So think about your organization. It could be your department also. It could be a clinic or a lab. And try to imagine who are the suppliers, who are the inputs, what are the inputs, process, outputs, etc. The new name, the modern name for the system map is value stream mapping, value stream map. This is a map which shows you how the value is created in the organization. So customers are interested in the value. See, customers are interested in the value. They are not interested so much in the product or service, but they are interested in deriving the value from the output. So for example, if I ask you, what is the value a patient is looking at from, say, from a hospital? The value would be, okay, can you tell me? I think it will be a good idea if you can guess. What could be the value a patient is looking at? Let's say I'm considering this time patient as the customer. So what is the value they're looking at? Okay, great. Okay, can you make a guess? Okay, cost effective. See, cost effective output should be there, but what is the value? What exactly the customers wants? First, you have to focus on the value. Timely care. Yes, you're right. Yeah, timely care. Improvement in health. See, improvement in health is the value. If I was to, yeah, some of you have already written that. Improvement in health is the value which the customer is looking at, if the patient it is. And if it's government, it will be improvement in the overall health of the population, and that is the value they are interested in. Now, this value is created through a series of steps. And of course, value is delivered through the output. Right? To make it very simple, let me make it very simple. Say, suppose I'm manufacturing a car. Okay. The car is the product, the car is the output. But the customers are not interested in the output. Customers are interested in the value they are deriving from the car. And this value would be probably ability to get transported from one place to another place safely, comfortably. Yeah, so that is the value. Similarly, in healthcare industry also, the value which the customers are looking at is improvement in health. To deliver that, obviously, if we follow different steps, we have got certain inputs, we have got certain process steps, and then we have got outputs, and through the outputs, we deliver that value. Now, the organizations which focus on the value, they are innovative organizations. But the organizations which focus on the outputs or the product or service, they are not innovative organizations. Please understand. Focus on the value. See, sometimes you will say, well, treatment is the output. I should focus on the treatment. But let me tell you, the real value for any patient or any government is not the treatment. It is better health. So the focus should be on better health or improvement in health. And healthcare system should focus on that value. Now, when we deliver this value, and that is why it is known as value stream, the way we deliver, we deliver value in steps. Yeah. That's why it's a stream through a series of steps. The final value is delivered to the customers through a series of steps. It's a stream. Not every step, I'm repeating, not every step is value added step. Although you're doing something today, but it may or may not be adding value. And any step or any activity which is not adding value is known as waste or non-value added activity. I'm repeating, any step or any activity, if it is not adding value, not delivering the final value to the customers, which is most important to the customers, if that step is not adding value or bringing the input to closer to the output, or if the customers are not willing to pay for that step, it is considered as a non-value added step. Okay. So if you are not doing something right for the first time, you're committing a mistake, and rework is a non-value added. Anything starting with review, revision, rework, checking, inspection. Now, some of you would be surprised. Checking, inspection, it is not adding any value to the customers. Why are you checking? Why are you having too much of inspection? Too much of audits? Why you are having? Because you're sure that you are committing mistakes. Suppose historically you have never committed a mistake. Your team has never committed a mistake in the last 2 to 3 years, 5 years maybe. Would you check? Would you waste your time in checking? Inspection? No, you would not. You are inspecting, you are checking because you're sure our system is going to deliver errors. And that is why we are checking. So better, don't focus on inspection. Better focus on reducing the mistakes, reducing the errors. And this automatically will reduce your inspection. Now, we are not saying from tomorrow you start your inspections, checking, etc. We are not stop your checklists. We are not saying like that. Please remember, we are not saying that tomorrow it's a waste and it's not like that. But the fact is, as a lean and Six Sigma professional, you have to identify that these steps are wasteful steps. So first, I'll talk about that very briefly. We'll take some examples from, let's say, the typical patient care process. What could be the possible steps, wastes, and I will talk about that a little bit, maybe in 5 or 10 minutes. But before that, before we go there, let me also, is it fine? See, first of all, I'll try to make it very simple in the beginning. In the second half of our training, I will also take you through through some of the statistical tools. I see, because most of you are totally new to Lean and Six Sigma, and this being a yellow belt program, uh, in the yellow belt program, you're not supposed to learn too much of statistics. But if you are interested and if you are finding it useful, I'll check with you maybe after half an hour. If you're finding everything useful and you're finding everything too easy, then maybe I will start teaching you a little bit about statistical skills, statistical tools and techniques which are very, very useful in hospitals. Then I'll also show you some projects which we have done in the hospitals. So any questions up to here? Any questions? So this is known as value stream map. Okay, this is known as value stream map. Okay, I think let me know if you have any questions on this. So please remember, if you tell someone that I have attended a yellow belt training, so at least some of the jargons you should be aware of. First one is value stream map. Now a mini version of that value stream map is, if you just take S for supplier, I for input, P for process, O for output, and C for customers. So that becomes SIPOC. So remember another jargon, SIPOC, SIPOC. So when we want to improve something, anything, if you want to improve anything, first is you make a SIPOC. You don't have to make a value stream map. Value stream map is done by black belts and if you're trying to change the whole system. But you can start as a yellow belt, as a green belt, you can start with a SIPOC. So we will take you through that process of DMAC as well. But right now, till now, we have learned value stream map and we have learned SIPOC, SIPOC. One more thing, let me write it here itself. If it's on the same page, it will be really good. See, how do the customers judge our performance? How do I know the customer is getting value? You cannot improve if you cannot measure. You cannot improve if you cannot measure. And the second rule is you can measure everything. Yeah. So the first rule is you can't improve if you cannot measure. Second rule is you can measure everything. And the third rule is if you think something cannot be measured, go back to rule number 2. That means everything can be measured. Now I'll tell you, how can you measure everything? Shortly, we'll tell that also to you. But if I just complete the explanation of this diagram, see, how would I measure whether a customer is happy or not? Let me think about some of the measures. Okay. We have a name for that in Six Sigma. We have CTQ, critical to quality measures. CTQ, critical to quality measures. Okay. Say, for example, see, typical examples are time, cost, errors. These three CTQs or three measures are always present in every process and every organization. Think about your KPIs. You would have all the measures related to time, errors, or costs. Apart from that, you will have different measures as well, like, for example, infection rate. Waiting time. Yeah, so let me take some example, waiting time. Waiting time, I have got, can you give me some other example? Infection rate. Infection rate. Okay. Now here you understand your performance. Where are you? So this part I will take to another page after a while, and we will understand how do we choose the improvement projects. Okay. So here we have got our customer. We want to make the customer happy. Customer could be government, patient, or shareholders. All three are our important customers. How to make them happy? First, the first thing is, what you do is, okay, before that, first you collect the voice of customer, VOC. Can you tell me some of the voices of the customers in hospital? Can you tell me? Voice of customers are always in sentences. So can you tell me? Yes, I'd like to hear from you as well. Yep. Write in the chat box. Yeah. Timely care. Okay. Timely care. Okay. Timely care. Okay. Okay. A long waiting time. Yes. Long waiting time. Thank you, Faiza, for that. Yes. Okay. Long waiting. Long waiting. Too much of waiting. Okay. Too much of waits. Right medication. I want right medication. Okay. Okay. So thanks for all these inputs, right diagnosis, etc. Yes, thank you. Thank you. So now just to take an example, because of the limitations of the time, I'll just take some of them. What we do is we create a measure. Okay. We create a clean hospital. Very good, Gul. Thank you for that. Clean hospital. Hospital. Okay, clean hospital. Thank you for that. Timely care. Measure could be response time. There could be multiple measure. I'm just quickly, okay, these two voices of customers, I can combine together. I can group them together. This grouping is known as affinity technique. Affinity technique. One tool, I'm telling you, affinity technique. By the way, as a yellow belt, I'll demonstrate some of the tools to you. You don't have to remember anything. When you are a green belt or a black belt, when you undergo this training program, we teach you the tools. We make you practice these tools, taking different examples. Right now, I'll do the project for you. Very soon, I'll be starting a project. We'll do a project. See, there is no point in learning just theory. We'll try to apply the theory to a project as well. So, yeah. So, response time, waiting time. I can just write here waiting time. Okay, great. Waiting time. And thanks, Mohammed, reduce infection risk. Okay, risk, yes. Okay. I'm not writing right now because now, we can write that as well. Reduce infection risk. Reduce infection risk. Yeah. And there are many more. Thanks for giving inputs. Lots of people have given lots of inputs, but I'll just proceed now. So waiting time. Okay. What could be the measure of right medication? Medication error. Okay. Okay. Cleanliness rating, maybe. Yeah. Cleanliness rating. Okay. And infection rate. Then you look at your performance. Okay. Before that, there will be always specification limits. Specification limit. Please remember this word. Specification limit. SL, we call it as SL, specification limit. And you may have upper specification limit or lower specification limit. You can have both upper or lower specification limit. Means you should operate within these two specification limits set by the customers. And please remember, specification limits are set by the customers. Okay, remember that. And if you are open to a little bit of statistical learning, I will apply some of the, I'll teach you some advanced tools also, which usually a green belt would know. But yeah, if you're ready and willing to learn, that will happen towards the end. So I will try to give you some more, some a little bit of concepts about control chart as well. But right now, specification limit, please remember, are given by the customers. So you can say it's a expression of customer's voice, VOC. I can also call it as VOC expressed in numbers. So response time should be less than, it depends on the treatment also. But let's say, think about a particular treatment and it should be responded within 5 minutes. Waiting time, it depends on the department, but I'm just taking example. It should be less than 15 minutes. Medication errors, it should be 0 or not more than, there could be specification limits also, less than 2 per month. I'm just giving some example. Please understand, just for purpose of understanding. Because see, sometimes people say, well, how can you say it should be 0, right? But are they 0 right now? No. Yeah, no. So please understand, sometimes specifications are set like that. Infection rate, like less than 1%. Just for an example of cleanliness rating, on a 1 to 5 rating, I should get a score of greater than 4.5. Okay. So something like that. Now you look at the performance. What is your performance? Suppose your response time is 10 minutes, but waiting time is 5 minutes. So you have to take a project here, but no project to be taken here. Medication error are 10 per month. You have to take a project there, and so on and so forth. So wherever you are not performing within the specification limit, you have to take up an improvement project. And these improvement projects are given to the staff members within the organization. Say, for example, if I am conducting a training program for a hospital, I've conducted lots of training programs. Towards the end, I'll show you some credentials, lots of hospitals, more than, I've lost the count, but it should be more than 100 hospitals in the last 30 years. I'm also having too much of experience, so that's very much possible. And more than 1,000 projects. I have either, most of the times, I've guided. Now, how can I claim that I have guided 1,000 projects? Because I've trained people like, for example, yellow belt like you. Yellow belts just understand the concept. They can't do a project. They know what is Lean and Six Sigma. They know what Lean and Six Sigma can do or achieve. They know what green belts and black belts do, but they themselves cannot do a project. Green belts who attend a 3 full days training, it could be online or in the classroom. And we do conduct in Australia, we do conduct programs on weekends. It could be online as well as last week I conducted a training program in Melbourne. So it was in person. So it could be face-to-face or it could be online. Whichever way, you become a green belt. And we also do a project in the classroom. So we give you the data and we together do a project. So then that makes you a green belt. Ideally, you should complete a real project in your hospital or a clinic or a lab, or if you are not from hospital, then in your industry. So that becomes a green belt. A black belt knows more tools and techniques more than green belts. So they attend 3 more days of training. When I say 3 days, it is like, you can say hours of training. So here, green belt is 25 hours, black belt is 25 hours. This includes a little bit of exercises as well. So it could be spread over the period of 5 days. Typically, we spread it over the period of 5 days. So 5 days of green belts, 5 days of black belts. And if you're in a hurry, some hospitals are in a hurry, then we make it 3 days and 3 days, but it depends on you. Approximately 25 hours of training is delivered. Along with every green belt or black belt, they do a project. Okay. And after that, you have master black belts. You attend 5 days of training. So green belts can do some good projects. Black belts can do, oh, by the way, I think it's not showing. We conduct training programs in Arabic, Urdu, because of Thai, right? Nowadays. Yeah, Thai as well. And nowadays you have got AI, right? So we conduct training programs in all languages, thanks to AI. And I'll show you, if time permits, towards the end, how is it possible? It's very much possible. We also give you videos in your language. Live trainings are in English, but the videos could be in your language. And I'll show you some of the videos. Typically, while conducting this training also, I'll try to use some of the videos so that you get an idea. So these videos stay with you. So as a green belt, you'll learn some tools and techniques. You are capable of doing a project. Black belt, You learn some high-end statistical tools and techniques, which go up to the level of hypothesis testing and design of experiments, etc. And then you can do some projects which can deliver millions of dollars of savings for your healthcare industry. Green belts, typically, they can save $100,000, $200,000, typically. But black belt can save around $500,000 to 1 million, sometimes 3 or 5 millions as well. Towards the end, I'll show you some of the video credentials in national healthcare services where we had saved millions and millions of pounds for the healthcare industry. And these projects really delivered some great benefits which can't be measured in dollars or pounds. Well, who are master black belts? Master black belts are the ones who train the green belts and black belts. So for example, I'm a master black belt. So 5 days training program. And for that, you need to have some experience also as a green belt and black belt. And then you can train and you can also guide green belts and black belts. It takes little time, but we do conduct. We are one of the few organizations, I would say in the world, which conducts the black belt, master black belt certifications. And we have been doing this for the last 20 years. Well, so I hope you understand who are green belts, black belts, master black belts. So typically, if I were implementing Lean and Six Sigma in your hospital, what I would do is we will choose projects, identify the projects. We'll identify the low performance areas where we are not able to meet the KPIs, and we allocate one, not more. See, don't try to boil the ocean, don't try to solve world hunger. So one KPI is allocated to one green belt age, and I'm just giving an example. Suppose you are starting with a green belt training, so everyone gets a project. So one team, you can do it in team as well. So one team gets a project to reduce the patient waiting time. Another team gets a project to reduce the patient discharge time. Another team can get a project to reduce the infection rate or in emergency room transfer. You choose your projects. You choose your projects depending on which area is most important for you to improve. And this again happens with the approval of the senior management. So sometimes I start the Lean and Six Sigma implementation, and most of the hospitals where I have implemented, we start with the senior management training. It could be a half a day training or a 1 day training if they've got time. The senior most managers, they get to know what Lean Six Sigma is. And once they understand what Lean Six Sigma is capable of delivering, then only they can tell their department heads and their employees and the staff members to take up excellent projects. And then they also know what to expect from the Lean and Six Sigma implementation. So this is how typical Lean and Six Sigma is implemented. There's a whole process and beautiful slides I've got, but as I said, we have time limitations, so I won't go into the details of how Lean Six Sigma is implemented. But if you are willing to wait for more after 1.5 hours, if you're still willing to wait for more, I'll be happy to answer a question, and I'll be happy to stay on for another half an hour or 1 hour also. And I'll be happy to answer a question. And while answering your questions, I would like to teach you more as well. Okay, so now coming back. So now, what is Lean and what is Six Sigma? Okay, now it looks very complicated looking at this. These diagrams looks very, very complicated. Now, don't worry too much. Lean is about identifying the waste in our processes. And there are 7 wastes: waiting, transportation, overprocessing, inventory, rework and rejection, underutilized resources, and overproduction. Let us take some examples first. Okay. So if you want to remember, there are multiple ways of remembering. So there are certain, you can say Tim Woods, or you can say I swim too, or you can say downtime. I think this is arranged in I swim too. If you rearrange those wastes, they can also become Tim Woods, or they can also become downtime. and they are waste of intelligence. Okay, waste of, your employees are very intelligent, but most of the time they are doing activities which are not adding any value to your patients. I'm sorry to say that, but 30 to 40% of your time is uh, okay, I can find a better word, invested, but actually it is known as waste, is wasted. These steps are not delivering any value to your patients. Scrap, rework defects, waiting, inventory, motion, transportation. Now, I won't go into too much of detail, but if you're interested, I've got some great videos. All of you can go through these videos and you can learn more, and they are totally free of cost. So you can just, uh, you know, there are 7. I have spoken about 7 wastes. There lots of videos are there. I'll be keep putting these videos in the chat box, and whenever you have time, you can go through those videos. And one more video, I will definitely like you to, because there's no time to teach you FMEA. Sorry for deviating a little bit, because FMEA, failure modes and effects analysis. This video has got more than 2 million views. Okay, so I've explained FMEA using a very simple example. And FMEA, some of you might already knowing, or some of you may be using it also, is failure modes and effects analysis, where you imagine how you will fail. FMEA, how you will fail. Very, very important video. It's given here. Just store this link, and definitely it's a 15-minute video. Please watch this, and you can use FMEA right there. Next week, you can use FMEA in your department or your organization, whichever department, whichever organization you are in. It was first used by Apollo mission. In Apollo mission, sending the man on the moon, they did not want to fail, and they used FMEA for the first time. And it is very much used in the healthcare industry, JCI, and all accreditation on all the best of the best hospitals. They use FMEA, and JCI actually recommends that all the critical processes should use FMEA, failure modes and effects analysis. I won't talk too much about that, because it takes a little time to explain that. But please, please, please do watch this video, and you'll learn a very, very important tool to improve the patient safety, patient care, and also any failure, to prevent any failure. Okay, coming back, let us take some examples of our 7 wastes. Okay. Sorry, I'm just going a little fast, because I'll focus on main points. This I had this example I had taken from, I was doing a training in Beijing hospital. Yeah, this was me 10 years ago. So let's say blood test process time. I'm just taking a simple example. Walking to OPD 4 minutes. Is it adding value to the patient? See, what is the value patient is looking at? Patient wants to know the status of the health, status of his or her health. But what we are telling the patient to do, walk, register. Is it adding any value? No. Walk again, wait, draw. See, what at the most patient would say, well, I'm willing to pay for these 2 steps. Okay. Remaining steps are waste, non-value added activities. And I'm not adding that if there is an error in between, then you have to redo everything. I'm not talking about that also. If you add that as well, there's a lot of waste in almost all of our processes. Some other example of waste of intelligence. 80% of nurse calls typically are housekeeping in nature. For nurses, you can ask any nurse. 80% of the nurse calls, like my pillow cover is dirty, my bed sheet needs to be changed. Now, this is waste of intelligence of the nurse. Nurse is there to give you medicine and to nurse you, but it's waste. We call it as waste. Or a surgeon is waiting for the operation theater to get ready. That's a waste of his intelligence. So these are some examples. Well, I'll just give some quickly, very, very quickly, some of the projects which we have done earlier in both UK as well as US. We doubled the cardiology lab capacity from 8 to 16. These are all published reports. These are all published papers also. We have presented in different conferences as well. So very quickly, we could, I'll not go into the details, but we could double the cardiology lab capacity, reduce the diagnosis to exam time from 2,700 minutes to 64 minutes, cut admission from 17 minutes to 5 minutes, and reduce the signatures or steps from 18 to 12. Approval is not adding any value. Approval, think of your processes of approval. First approval, second approval, third approval. Approval is a waste, non-value added activity. What does the approver do? Well, we studied lots of processes we've studied. What does the approver do? Just, in fact, there was a CEO. I'll tell you one story. There was a CEO, and first 1 hour, he was just signing some documents. We just observed that. How do we observe? We do a Gemba walk. Gemba means Japanese. Gemba means go to the place of action. Observe yourself, how the things are taking place. Observe, go to the place of action. We call it as Gemba. So Gemba investigation. Gemba means when you observe how the things are taking place, you observe a lot of waste in your process. So the idea is to reduce the waste as much as possible and create value for the customers. So we found that that CEO was signing the documents. Now we asked him, like, what exactly you're doing? He said, well, I'm signing. But you're not even reading the files. Well, how can I read the files? They're too thick, so many pages are there. I can't read. So, but I trust my vice president, and they have seen everything. You go to the vice president, he's also doing the same thing. He's also signing. He trusts his senior manager. And if you go to the senior manager, he trusts his manager. And if you go to the manager, he says, yeah, well, my executive conducts lots of, there are lots of mistakes, not lots of, but some mistakes, and I just check it and correct it. So maybe if you still consider as approval as a value-added activity, you have to say only that activity of manager checking or approving, that is a value-added activity. But even that is also not considered as a value-added activity, because we would say that why the executive is committing mistakes? Why don't we train him? Why don't we eliminate the errors so that there is no approval? See, nowadays, approvals are being automated. Why? Because approvals are not adding any value. Most of the automation is focusing or attacking the non-value added activities so that you can focus on the value added activities. Most of the AI, some people say, well, AI, I'm going to lose my job, and nothing is going to, it's not true for sure. In fact, AI will free you from waste, non-value added activities, filling up the form, making reports after reports after report. You're not treating the patient, you're making reports. It is definitely waste of your intelligence. Okay, so unnecessary process, motion, unnecessary waiting, errors, transportation, they are all examples of waste. A person who's underutilized is a waste. There's another waste called overutilization. That is also a waste. Underutilization of equipment or overutilization of equipment, they are all waste. Cost of a 5-minute walk, it's a waste. Walk to elevator 1 minute, elevator wait 3 minutes, elevator travel 1 minute, walk to lab 1 minute, nurse cost per hour $50, cost of one trip. Okay, so you can see how much of waste is there. If you have got 200 nurses in a large hospital, multiplied by 365, you can imagine there's a waste. Just waiting for the elevator runs into millions of dollars of waste. Okay. Lab and pharmacy on second floor, radiation equipment on ground floor, you are going up and down, it's all waste. Why don't we have that on same floor? Exam room interruption is a waste. There's one more concept called poka yoke. Poka yoke is a Japanese word which means mistake proofing. Mistake proofing, also known as foolproofing. Foolproofing. Even a foolish person cannot commit a mistake. Sorry, foolproofing. Yeah. Sorry, I'm in a hurry. I'm trying to teach you more and more in the shortest possible time. So Sorry for that. So foolproofing, mistake proofing, pokayoke. Pokayoke means even by mistake, you cannot commit a mistake. So I'll give you some examples. Yeah. Machines cannot be set or not operated beyond normal, safe, or maximum levels. Oxygen, nitrogen cylinder, their connectors are different. You can't connect, even if you want to connect, you cannot connect. So foolproofing, even a foolish person connects, they can't connect oxygen to nitrogen. So these are some examples, of Pokayoke, which prevents the errors. So it is again part of your Lean and Six Sigma toolkits. Some more examples of Pokayoke: fixed number of packages during surgery, complete catheter kits for insertion, prepackaged medication card with correct doses. These are again examples of Pokayoke. So think of Pokayoke. How can you apply Pokayoke to reduce error? So rather than correcting, checking, inspecting, we should create a system which is not able to produce any errors. So this was all about a lean part. Just wanted to talk very briefly about lean part. Now, what is Six Sigma? Six Sigma is about doing a project, identifying your process, measuring. So let us learn about DMAC, define, measure, analyze, improve, and control. DMAC. I have an example here of recruitment process, but I'll take an example of patient discharge process. I think that will be now. See, right now, as I am showing you a project, because you have not learned any tool or technique, the purpose of me showing the project to you is that you should be able to understand the power of these tools and techniques. Yeah. Very briefly, I'll tell you about these tools as we go along, and I will try to restrict my explanations to the simplest. I'll try to use simplest language and try to avoid jargons, but as much as possible. But the purpose here is, as a yellow belt, you should know what green belts are capable of. Okay. So we are talking about DMAC, define, measure, analyze, improve, and control. So we are doing projects. Define, we've identified the problem. Okay, first let me ask you, would you like me to take some very simple day-to-day life example and then talk about the, let's say, patient discharge process, or I can directly go to the, one of the hospital-related processes? Just let me know, because last time I was conducting, they said, oh, well, day-to-day life examples are really easy for me to understand, but I'm open. If you're okay, I can directly take you through the some of the processes, or something which is directly related to some of our healthcare processes. Anyway, healthcare processes project will be showing, but do you want me to take very simple example and then go to the healthcare processes, or directly I can jump to the healthcare processes? Okay, let me check. I think, are you able to write? I think has been disabled or what? Okay, I don't see any response. Is it disabled? Okay, okay. Good. Thank you for that. Okay, healthcare process. Okay, let's take a problem. Problem is, let's say, patient discharge time. Okay. Patient discharge time in our hospital is, let's say, 5 hours. Okay. Yeah. Uma is telling, okay, directly healthcare process. So let's take that. We will have a goal statement. We'll have a goal statement. We would like to reduce this 5 hours to, let's say, 1 hour. It could be anything, 2 hours, 3 hours, you decide. But this has to happen within 3 to 4 months. So you have a timeline also. In the measure phase, you measure. Is it really 5 hours? Is it really 5 hours? So in Lean and Six Sigma, we don't trust anyone except data. Dr. Deming used to say that, in God we trust, rest others bring data. So I'm not going to trust you if you
Don't show me the data. So, well, you said it's taking 5 hours. Is it really taking 5 hours? We collect the data and we find, yeah, 5, 4.5, 3, 5.5, 6, 5, etc., etc. You'll be surprised to find and know that most of the processes, if you make a histogram, and this is known as histogram. Now, please understand, I've not taught you what is a histogram, okay? But some of you might be knowing is, I'm just assuming, okay? So as a green belt, you learn what is a histogram. It's a historical representation. It's a graph which represents your historical data. Histogram, historical graph, okay? And you'll be surprised to know that most of the processes, they follow a distribution which is in like a bell-shaped curve. We call it as normal distribution. Normal distribution, because it's normal to obtain a normal distribution. Okay. So first, green belt or black belt, green belt, what they do is they collect the data and they identify the shape of the curve, how we are behaving, how the process is behaving. Okay. Obviously, let's say now it is 5 hours and it goes as low as, let's say, can I say 3.5 hours here, and we can say 6.5 hours. This is how we are operating. This is how we are operating. Okay. Now, why we are operating like that? Again, Dr. Deming used to say the problems are not in the people, problems are in the processes. Problems are not in the people, problems are in the processes and the systems. So change the system, change the processes, the same people will deliver excellent results. So Lean Six Sigma talks about process excellence. Okay, process excellence. See, no staff member or employee comes to the office, clinic, or hospital. Today, I will come and, I'll have, collectively, we will deliver 20 errors today. No one thinks like that. No one thinks like that. Yeah. But by the end of the day, if you measure the number of errors or complaints, let's take it simple like that, complaints, patient complaints. No one has a goal. Today we have a goal of receiving say 50 complaints. It's a large hospital, let's say 50 complaints. It could be per day, per week, whatever. No one has that in mind. But unfortunately, by the end of the day or by the end of the week, you get those 50 complaints. And this has been happening for the last 6 months, 1 year, 2 years. It won't be exactly 50 complaints. It could be 50 plus minus 10 or 20. Again, if you make your histogram, it will also look like this. This 5 will become 50, 3.5 will become 35, and 6.5 will become 65. So this is typical behavior of every process. Your waiting time, your infection rates, everything follows this normal distribution. Okay. So we teach you this in detail. Well, we have got 3.5 here. If I talk about discharge time, I'm just taking an example, and here 6.5. So we call it as control chart. 3.5 hours to 6.5 hours. This is how our process is behaving. Look at last 6 months data, 1 year data. You are going to deliver between 3.5 to 6.5. Or very rarely it goes down also. Very rarely it goes up, but due to some special reasons. But most of the time, you deliver within those limits. We call them as control limits. Remember, I told you one specification limit. Specification limit is set by the customer. But these control limits are set by the process by itself. Process finds its own way. It says, well, I will behave. My patients will be discharged between 3.5 hours to 6.5 hours. I'm talking about patients being discharged once the physician says you are good to go, but still you are waiting. Yeah, 3.5 to 6.5 hours. So this is our present performance. That is our measure phase. Then comes analyze phase. You identify the causes. In a short while, I will show you how actual project is done using real data. In a short while, I'll show it to you, but I'm just giving you an overview right now. So here we use fishbone diagram. We call it as fishbone diagram or cause and effect diagram. Looks like a fishbone. So we put whatever we want to improve. We call it as Y. We designate it as Y. Y here is patient discharge time. So I put here Y, which is patient discharge time, the letter Y, yeah, alphabet Y. Yeah. So here, and the factors which are impacting my Y, my effect. This is the effect. Yeah, this is the effect. These are the causes. We brainstorm on all the possible causes and then identify what could be the reason. Anything, whatever comes to our mind, we just put there. After that, we prioritize the causes. Again, based on the data, we use different tools like Pareto, box plots, scatter plots. If time permits, I'll show each one of those tools to you as a demonstration. Pareto, some of you might have heard of Pareto, 80-20 rule. Wilfredo Pareto was an Italian economist who found that 80% of the wealth in Italy was with 20% of the people. He called this 80-20 rule. Yeah. He found this was true for even the crops as well. 80% of the crops produced in Italy were coming from 20% of the crop types. In hospitals also, 80% of the patients are coming for the treatments of only 20% of the diseases. Yeah. So this is true everywhere. And 80-20 rule. So Joseph Juran, he applied to quality. He said, 80% of your problem, whatever you are trying to solve, is due to 20% of your causes. So which are these 20% based on the data? You identify them. You get your root causes, and then you improve on that root cause only. Only on that, you improve on those root causes only. Okay. And then once, let us say, so I'll show you a project and I'll tell you what were the root causes they found. As I do the project, I will also show you how a green belt does his analysis. Yeah. And if you are willing to wait a little bit more, I will even show you the full project in real life also, how such projects, many hospitals have already done. So yeah, coming back, whatever is the root cause, let's say patient discharge summary time is taking long time. That is the, or insurance time. Let's imagine if it's a private hospital, insurance time. That is taking time. These are the two root causes. We'll just find solutions for these two root causes. And what was 3.5 to 6.5, we drop it down to, let us say, 1 hour to, let's say, 2 hours. Okay. So the process has found its new control limits. The process has found its new control limits. Now, control limits, remember, what was the specification limit? Specification limit is set by the customer. So let's assume specification limit was KPI was you should take less than 3 hours. This is the specification limit. So your control limits should be always within the specification limits. And the green belt makes it happen through DMAC. Okay. So that is what DMAC is. Now let me show you. We will see the project. We'll first I will look how a typical project is done, and as the time permits, depending on the time and how much time you are willing to spend on. If you're willing to spend more time, I will show you the final project also. But any questions till now? Any questions? And my team can also tell me how much time is remaining. If you can very quickly tell me so that I can plan my remaining time. Just give me 1 minute. Yeah. Any questions? I'm just looking at, if you have any questions, please write And also, if you want me to spend time on some topic, a specific topic which you may be interested in, I'll be happy to take your inputs. Okay, so I'll take a simple project template, which see, every project, we give you a template also. When you are doing a project, we even give you a project template. So I'll just take out one project using a project template, which are, yes. So this is a reduction of discharge time in hospital. Now, imaginary project, this is an imaginary project, okay? And first you want to improve the discharge process, right? So first you look at the process, because problem is in the process. I told you, problem is in the process. Remember that this is a hospital. Let's say 500 people are working in the hospital. Ask them, what is your target of, let's say, patient complaints, by the end of the day? And let's say large hospital. No one says my target is 5, 10, 20, 50, but by the end of the day, you produce 50 complaints. And this, as usual, will have its own control limits. So if I take an example, 35 to 65 complaints we are receiving every day for the last 1 year, 2 years. This is the way we operate. We call it as control limit. We call it as lower control limit, and we call it as upper control limit. And how do you get them? Very easy. Any statistician will tell you. It is coming from Gaussian theorem. Gauss, Mr. Gauss, Carl Friedrich Gauss. Yeah, he found that most of the repetitive processes, they follow normal distribution. And he also found every process has got an average. Yeah, every process has got an average. And every process has got a standard deviation, which can be easily found out. If you are very much interested in knowing what is standard deviation, and even if you're interested in deriving the formula, I have derived the formula of standard deviation also for those who are statistically oriented. I will just leave it to you for you to watch that video. Right now, I'm not going to go into the detail, but some of you might be interested. What is standard deviation? What's its use, etc. I've got a video done. You can always watch it at a later stage. But just coming back, what Gauss found was every process has got an average, and every process got a standard deviation. And 99%, almost 99% of all your population data, I'm talking about population data, not the sample data. But he said that if you just collect 30 samples from every process, any process, for example, here 30 patients being discharged, just 30 samples if I collect, and I find averages something, let's say 5 hours, and standard deviation is, let us say, 0.5 hours. So he said that plus 3 times the standard deviation and minus 3 times the standard deviation, plus and minus 3 times the standard deviation will lie 99%. And this is true in nature. This is universally true everywhere. In the class, generally, I take an example. We take the height of everyone. We find the height. 20, 30 people are usually present in our online classes. And we take the height of everyone. 30 samples if we get, we can predict about the height of the whole world, 99% of the people. So we calculate the average, we calculate the standard deviation, and we predict the standard using standard deviation and plus and minus 3 sigma using Gaussian theorem. We predict 99% of the people in the world are within those limits. Very easy. Okay. Now, all this sounds very technical in nature, but now we have AI. You have got, so everything's automated. You have to just learn the technique, learn the concept. That's it. And everything is done by you. Sorry, nothing is done by you. You should know how to do it. That's it. Everything is done very quickly by the softwares and etc. So once you have understood this concept, how did we get these 35 and 65 complaints? 500 people going in the hospital, every day, producing 50 complaints. They are not producing complaints. The processes in the hospital, the systems in the hospital, the way we have trained our employees, the way we use our equipment, the way we maintain our equipment, the way we follow our processes, the kind of SOPs we have, they are delivering these 50 complaints. They are delivering the 50 complaints, not these employees. None, see, any reward, even if if you put reward like everyone receive $1 million if you reduce these complaints to, let's say, zero. Everyone receives $1 million. However hard these people try, they will never be able to achieve zero. Even if they will achieve 35, they will deliver like this only, because you're not changing the processes. Or no threat also can make them deliver anything below LCL or LCO. What can deliver? DMAC project. Proper DMAC approach. Define, measure, analyze, improve, control. Get to the root cause using statistical approach. That only can deliver. Okay. So coming back, we have started a project, a typical green belt. He first makes a SIPOC. He or she makes the SIPOC, supplier, input, process, output, and customer. Now, I'm not going to go into the details of what is a SIPOC, etc., how to create it, but they create it. I'm just going to show you the flow. Yeah. So you identify the customers, what are the outputs, what are the basic steps, okay, what are the inputs, and who are the suppliers. So that my focus will be on the process. I will not blame the people. Okay. And then we'll create a problem statement and a goal statement. Okay. Problem statement is it's taking 5 hours and we like to reduce it to 22 hours. It's a SMART goal statement. Okay. Then we actually check. We check whether it is really 5 hours or not. So we collect the data. You can't improve if you cannot measure, right? I'll just show you. In minutes, now we're in minutes, not in hours. Whenever you want to measure, try to measure in 1 unit less than what you are interested in. If you are interested in hours, measure in minutes. If you are interested in minutes, measure in seconds. That's what one of the basic rules of statistics says. So this is my 15 patients. I just collected data of 15 patients. Okay. And as a green belt, you learn to click the buttons. Nowadays, AI can also do the job, but now I'm showing you. So please don't worry about how it is done, etc. You can learn. You can come to my green belt sessions. I will be happy. Very slowly we teach you, not in a hurry like this. And we also keep taking your inputs when you join on my green belt sessions, black belt sessions. And I have been doing this for the last 20 years. Okay, I enjoy doing it. I still enjoy doing it. I don't plan to retire very soon. And you should not allow me to retire so soon. So yeah, so see, look at this. It is giving me normal distribution, and you'll be surprised to know it will give you the average mean 300 minutes, standard deviation 25 minutes. Okay, I can predict plus and minus 3 times standard deviation how this process must be behaving. Or if I don't want to predict and do any calculations, I can tell our mini tab, or there are so many free softwares available. Well, please give me the, please tell me about the, how do you, what are the control limits? Okay. So now the control limits are, okay. Let me show you. It's very, okay. So I'll just put that. Please make a control chart. It will tell you, well, in this hospital, 99% of the time, you will take 227 minutes to 300 minutes. This is the way we operate. This is the way a hospital operates. Most of the times, your dashboards will give you those numbers. Yeah. But now you know how the dashboards are calculating the numbers. Once you know, this is how your process is behaving. Well, you're not happy with that. You would like to reduce it. Well, you should go ahead. And okay, so what we did was, if I were doing a project, this is how, this is the one left side. I display. This is what is my average, what is my standard deviation. Well, this is how we are behaving. We're not really good. We need to improve. Okay. This is the control chart. Okay. We need to improve. It's not what we expect from this process. Well, why we are like that? We use we use a cause and effect diagram. We brainstorm on what are the possible causes. You can there's a lot of techniques. One of the most popular ones is 6M: man, machine, material, method, measurement, and mother nature, environment, or mother nature. Try to brainstorm on all the possible causes. Well, they do that. And once they do it, just ask, please create a cause and effect diagram for me. Okay, great. It will create for you. And now I'm clicking the buttons. Nowadays, you can even speak, and it gives you everything. But if when I'm teaching, I'll not teach you like that. At least I'll show you how it is done. At least some people in the world should know how it is done, right? So green belts and black belts actually know how it is done. So this is a cause and effect diagram. These are the possible causes. Well, all the possible causes, but let's apply Pareto 80-20 rule. Well, what we do is we collect the data. We start collecting the data. Patient number 1, okay, discharge reporting was not accurate. Some report error was there. Okay, so many causes. We have listed down all the causes, and you'll find that some of the causes are repeating again and again and again multiple times. Based on the data, you ask. See, it's very simple clicks. You already have this data in your hospital, a lot of data you collect, but you don't know how to analyze it. So what we do, okay, please tell me which reason is occurring or more frequently. Okay, reports not accurate, errors, staff not available, pharmacy delays, discharge summary delays. These are based on the allocation of causes. When we are collecting, maybe I told 2-3 nurses or 1 or 2 physicians, maybe they helped me in collecting the data, and you don't have to collect too much data. A small sample is good enough. Sample size, we teach you, and we give you the confidence also. Just 30 samples is good enough to predict about millions and millions units of the population. Just 30-40 samples for continuous data. By the way, there are 2 types of data: continuous data and categorical data. So for continuous data, which has numbers, we generally collect 30-40 samples, and good enough. That's good enough to make predictions. And if it is attribute data, then it is a little bit more samples generally. Okay. Okay. So first of all, I don't want to. You are willing to wait for a while, because we have got. So I can finish everything in 5 to 7 minutes also, but I can go on explaining certain. What I'll do is, let me first complete the session very quickly by showing you the overview. Then I will start explaining the tools and techniques in more detail after a while. So typically, and now I found what are the real reasons. Well, we'll not leave it so easily as a green belt. Well, we assigned the reasons. We also have one more tool, which is also known as control impact matrix, which is in our control, so this can filter out some of the obvious things which are not the root cause. So which is in our control, which is out of our control, which is having high, medium, and low impact. And then we can still do a Pareto the way. So now we have got 2-3 causes. As a green belt, you can even validate these causes. Is report accuracy, is it real a problem? Is staff availability a problem? Is discharge summary delay is a problem? Well, how would you validate that? See, so what you do is, I hope you are fine with this much of complexity, or is it getting too much complicated? Well, I'm now entering into the area of green belt. As a yellow belt, it's good enough for you to understand DMAC. What is DMAC? What is defined, measure, analyze, improve, and control? Some of the tools and techniques you have understood. You're not supposed to tell anyone that how Pareto is done. You're not supposed to tell anyone how cause and effect diagram is done, but you should know there's something called cause and effect diagram as a yellow belt. So you've got sufficient knowledge available, but I'm just going into a little bit of more detail. So, well, now, someone thought while assigning a reason, who was collecting the data, that this patient got delayed because of this or that. No, we will further validate that using the data. Okay. I would love to. Okay, what I will do, my team is telling, at least for those who would like to, uh, go at just to show you a project, typical project, what happens is you validate. Now, I'll show you. If you're willing to wait, I'll tell you how why I'm using here scatter plots and how a scatter plot is done. Why I'm using here as a box plot and how box plot is done. See, when I have got discharge summary delay, which is continuous data, which is a number, and discharge time, which is also a number, I will make a scatter plot. And if there's a pattern, I will say, well, discharge summary delay is impacting. It's a root cause. It's validated. But what about the pharmacy time? Well, pharmacy time could be anything, but there is no pattern. There's no relation. So pharmacy time is not the root cause. Although the person who was collecting the data, they felt like it, but the data, the further investigation is showing it is not the root cause. So don't make the mistake of improving the pharmacy delay, etc., and try to and think that I'm going to reduce my patient discharge time. It's not going to happen. Similarly, reports accuracy. Reporting is correct in those patients where there were no errors. We took less time. Yes, less time. But where there were errors, we took more time. Well, reporting accuracy matters. Errors, we need to fix them. It will really impact my discharge time. But what about the staff available? Staff is available or not available? Almost same. Available, still you are taking more time or less time. Not available, still less or more. It is not the root cause. So you validate them. There are other statistical tools also which you use. And finally, once you know, okay, of course, you also do identify the wastes in the system. You also do an FMEA. Remember, in the beginning, I said FMEA, failure modes and effects analysis, very, I think, very interesting and a must-see tool. Please watch that video. I have given you one. Once again, I'll give it to you to motivate you. It has got 2 million views. So people must have really found some benefit out of it, and I'm sure you are going to increase those views again. And please watch it in full, and you'll really, FME is an independent tool. You imagine how you fail, how you'll fail. Like for example, discharge process. What is the failure mode? And then what are the causes, and then after that, what are the occurrence rating, 1 to 10, you give occurrence rating here. How severe is that issue? 1 to 10 rating, 1 to 10 rating, 1 to 10 rating for how good your controls are. Multiplication of all those 3 ratings gives you risk priority number, and based on the highest risk priority areas, you take make a solution or give a solution and implement it. That's what FME in short is. Well, after a very in-depth analysis, you get to know you have got your root causes, and then you give your solutions. And once you give your solutions, you will find after so much of in-depth analysis, definitely your process is going to improve, and you can easily see that your control limits earlier. These were the control limits, if you remember still, have changed. Your DNA of your process has changed. If you had not done the project, this would have been like this. Sometimes we keep feeling happy. Oh, discharge time is reduced. I'm happy. It will increase again. Oh, again happy. Again unhappy. Happy, unhappy. This is how we keep on managing our processes. It will be the story forever. Do a DMAC project based on root cause analysis, based on data. Find the causes. You'll really see an improvement. So that was, in short, I just wanted to tell you. And also, if you are interested, we do conduct the Lean and Six Sigma Green Belt and Black Belt training programs in person in Melbourne. We conduct. Anyone interested in having Melbourne, we conduct in Riyadh, we conduct in Dubai, we in person, we conduct in Bangalore. But yeah, online, everyone is welcome. I see people from UK also joining in, and people from Australia. Of course, most of you are from Australia. Thank you for joining, and others who have joined in different times on Riyadh. People from UAE have joined. Thanks, special thanks to them. And yeah, we have got another program for US as well. But yeah, but coming back to my final presentation, of course, lots of things are there to talk about, but I was talking about showing you National Healthcare Service. What are the timings? What are dates? My team would like to, meanwhile, talk about the dates. When are the, and also I'll be happy to take up some questions. And if you are willing to wait, I'll show you how to construct the cause and the scatter plot, box plot, and why did I use scatter plots? Why did I use, when to use scatter, when to use box plots, everything I'll explain to you in a short while if you are willing to wait. But till then, for those who want to proceed, those who have other plans, they can leave, but not before knowing about the offers which we have. We also do CPHQ, Certified Professional in Healthcare Quality, certified by NAHQ US. If you are interested in doing that course, let us know. We can combine. We also run a program which is CPHQ plus Lean and Six Sigma Green Belts. And then we have got Six Sigma Green Belt, Black Belt, and Master Black Belt full course, which you can finish in Green Belt and Black Belt. You can finish in one and a half month, and Black Belt typically it takes 6 months. And you can do a project if you want. We can guide you as you do the projects. Okay, so Umar says, how indirect causes are affect the analysis? Yes, indirect causes, they impact the analysis, and you don't ignore them as well. Yes, so they, you see, direct or indirect, yeah, anything which impacts is important for us. But the data should prove, the analysis should prove that yes, it is a root cause. And if it is, definitely you'll take an action on that. So that is what is the other thing? Schedule. My team, do you have the schedule with here? Or we'll be sending it to those who are interested. I think, okay, let me have the poll. Oh, sorry. I forgot. My team is telling me to, can you put the questions? So those who are interested, I'll be happy to, first of all, if you can answer how confident you are in applying Lean Six Sigma concepts in healthcare. Now, I know you may not be too confident, but at least a little bit something. Yeah. So some of you are, most of you are telling, wow, very confident. Okay. I would say that you should learn more. Yeah, you'll be much more confident. Okay, great. So many of you are telling very confident now, but response, not everyone has responded. I would like you to respond as well. So if you can just tell me. Okay, next question, please. Next question. Okay, can you go for the next question, please? Let's switch on to the next question, please. Okay, when are you interested in to learn further as a green belt or black belt? So if you can tell me now, depending on your answer, I'll send you the information. Those who are not interested, obviously, thanks for attending. And I hope you learned something. But those who are interested, we'll be happy to send you the details. We'll tell you the timings, the dates, the days. Typically, every Saturday, we have a training. Every evening also, we conduct the training programs. I think the dates, our team, if you can just let me know the dates for Melbourne program. If I think they don't have, okay. So dates of Melbourne program, I'll tell you, I have got here in my calendar. So it starts on 20, it starts on 19th, yes, 19th April, 26th April, and 3rd, 3 Saturdays. In person, Melbourne. If you're in Melbourne, I'm in Australia for 1 month. After that, I'll be going to Dubai. So there also we'll be doing the training. But yeah, in the evenings, we have got online trainings also. So if you can attend online trainings as well. But if you want to attend in person in Melbourne, we have got these 3 days of Greenbelt, which is 19th April, 26th April, and 3rd of May. So these 3 days, you can become a Greenbelt. Yeah. This is for your for those who are asking questions. And okay. Yes, we'll send you the venue also, depending on the number of participants. We have got 2 venues, and depends on depending on the number of participants, we'll be selecting the venue. Okay, so now finally, some yeah. Okay, we also have our other programs like Certified Professional and Healthcare Quality, PMP, Project Management. So the programs which I conduct is CPHQ and Green Belt and Black Belt. I also conduct the PMP, Project Management Professional. And we have got trainers who conduct Power BI, data science, and AI, full study of your AI in healthcare, a part, basic AI in healthcare, giving you basics of AI in healthcare. I conduct that training program. In fact, if you are a black belt, you get the foundations of AI in black belt. So that is incorporated in it. Okay. And yes, anything else you would like to show? And now I will be happy to answer your questions. And if you're willing to stay, okay, finally, yeah, we have got this. Thank you. I was looking for this. Yeah. So yeah, so right now we have got the classroom training happening, and thank you for that. Okay, so those who are interested, they can enroll. And for Dubai face-to-face, for online, we have continuous training. Every day we conduct morning session, evening session. As per your time zone, we have morning session. For those who want morning trainings, they can conduct appear for mornings, evenings. If they want evening 2 hours training, you can appear for you can join 2 hour evening sessions. Those who want weekend, Saturdays, or Sunday, we have got, depending on your need and requirements, we all have all kinds of times where we conduct the training programs. Okay, coming back now, let me show you what I will do is I will show you how we maybe some examples. How can we implement Lean and Six Sigma in a hospital? So I'll show you the roadmap. Then also I'll show you the other part, which I was talking about. Okay. Okay, fine. Great, great, great. So we have got a some discounted price. Yeah, some very, very great discounted price for you if you want to become a green belt and black belt, as you saw. And yes, please, can you give me the screen? Now coming back, now some of you have chosen to stay. Okay, most of you have chosen to stay. Okay, so very quickly, I'll show you how typically Lean Six Sigma is implemented in hospital. So different departments, you choose the projects, you choose a steering committee. Typically a quality leader would be, part of that. And we train the HODs. We call them champions or sponsors. We train the HODs. Once they know what Lean Six Sigma is, they nominate their green belts and black belts. We train them as a green belt and black belt. Or if you want to go for black belt also. Otherwise, you can start with green belt. And these green belt projects are given, as I was explaining in the beginning, are allocated to the teams, and we guide them. So we created an infrastructure, we train the people, then we guide them. For a particular hospital, generally, we choose 5 projects to 10 projects. lot of biggest hospitals, lot of well-known hospitals. NHS, we used to do in 6 months, we used to run 35 projects simultaneously. Yeah. So I'll just show, yeah, this one I was showing you. So once you are, one thing I forgot. So green belts and black belts, once they do the project, they present the project to the master black belt, like they will present to me, plus they will also present to their sponsor, to the department head. And once both of us say, yes, good to go, we give you a green signal, then you get certified. So here, this is just an example, just here.
Well, we have Alex with us, and he has done excellent Lean and Six Sigma projects in National Healthcare Service and in hospitals. So, Alex, would you like to tell us something about it?
Hello, I'm Alex Wells, Head of Service Improvements at the Royal Liverpool University Hospital. I've been really fortunate to present today on how us as a trust are using Lean and Six Sigma principles to deliver better care for our patients. I've presented today on a lot of the work that we've done around how we've improved patient outcomes, reducing mortality, improving length of stay, and also talked about how we can actually realise some financial benefits from that. Over the past 2 years, we've been really fortunate that we've done some good work, and it's actually delivered us £2 million worth of quality efficiencies through delivering better patient care.
Yeah, so that is again, similarly, we also had, in fact, lots of projects now in different domains also we have completed. So we have got not only healthcare, we have got banking, we have got IT, we have got logistics, we have got supply chain, we have got manufacturing. So even if you are from those industries, we'll be happy to train you. We run those programs separately. Lean Six Sigma for manufacturing, Lean Six Sigma for healthcare. The tools and techniques remain the same, but yeah, applications, they keep changing. And the examples also, we'll take, if suppose your hospital is interested in Lean and Six Sigma implementation or only learning or training, you can always, I'll be happy to deliver a free yellow belt training in your hospital. Yeah. So just connect with me at any time, connect with me, my team. I'll be happy to deliver a free half a day yellow belt session in live in your hospital. And I'm talking about, yeah, so Australia right now. Next month it will be Dubai, and after that it will be Bangalore, and after that it will be Riyadh and Jeddah. So wherever you would like. And plus, if you want to do Lean and Six Sigma projects, we have got a team of master black belts who can guide you. So when you do the projects, we guide you online. Online, we'll keep guiding you in the define, measure, analyze, which data to collect, what tool to use, etc. Now, because many of you have stayed on, let me show you why did I use after Pareto. I'll take you a little bit into more details of that analysis part. Okay. Okay, so let me begin with telling you that there are data. There are two types of data. Okay. The data which you can see there is in number. Actually, see, some people tell me you cannot improve, you cannot measure, you are saying, but how can I measure everything? So answer to that is, okay. Now, see, when you join our training programs, you also get lots of videos. Yeah, these videos contain all the explanation, whatever I just was talking about, everything these videos have, and these videos stay with you forever. Yeah, so once you join our session, download the app, and the videos are with you, and you can refer to these videos. I'll just give you an example. Okay. And whichever language you want. Well, right now I'll show you in English. It's so easy nowadays. So I did talk about, if you remember, Pareto and yeah. So let me show you that.
Once we have collected the data in the measure phase, now it is time to analyze. After all, we have collected the data to analyze and get the root causes.
So this talks about, you start with there are actually two doors. If you want to go into the details, in the analyze phase, you can take data door like cause and effect, control impact, Pareto, box plots, and scatter plots. Or you can take the lean route like as is process map, Gemba walk, value added and non-value added analysis. Yeah. So we are learning one by one. One more tool, which very quick to learn, is 5 why analysis. 5 why means ask why 5 times. Ask why 5 times, and you'll get to know. Yeah. Why? Why? Like I'll give you an example. Let me show you an example. Those who are still waiting are willing to learn. You'll get to learn a little bit more. Yeah. Okay. There is the 5 why analysis. Let me show. Yeah, this one. This was here. Yeah. So let me demonstrate this 5 why analysis using a simple example. Or if you're willing to, yeah. Wait. Yes.
Root causes. We can use brainstorming to generate a lot of potential causes of the problems you defined in measure phase. You can use why to push for root causes. To push for root causes, start with your focused problem and then ask why several times. For example, focused problem could be customers complain about waiting too long to get connected to staff during lunch hours. You can ask why 5 times. Why does this problem happen? Because backup operators take longer to connect callers. Why? Because backup operators don't know the job as well as the regular operator or receptionists do. But why don't operators know the job well? Well, there is no special training. No job aids make up for the gap in experience and on-the-job learning for the backups. Why? Because in the past, the organization has not recognized the need. But why? Because the organization has no system to identify training needs. So this becomes the root cause. 5 why becomes a way of mild deep thinking.
Okay, so that was one more tool for you. Similarly, all the tools are explained using examples. All those examples, we start with very simple examples, and after that, we go to the domain specific examples. And the same thing which I was explaining, they're all like the how to make a cause and effect. Yeah. So everything is given here, like for
Tools, and then choosing cause and effect diagram, and then selecting the respective columns against the names of the columns. After that, I can also write the effect and also label the cause and effect diagram. This you can try it out yourself by opening the procurement cycle time case study.
So the specific case study for your domain is given to you, and you can learn by yourself also. Just wanted to show you that these things will all be okay. There's another one, Pareto. We spoke about Pareto, but how the Pareto is done. So exactly the process of making a Pareto, it's fully explained how it is created.
Listed down 5 causes. I'm just taking.
So here, everything, all the tools are explained in detail: box plots, scatter plots, some like how to create the regression equations, everything. Everything we train you in the classroom, plus also we give you the videos also. Like the one, we're talking about process maps, how to map the processes, how to make the value stream map, everything, how to identify the non-value steps. I know so many things. Taking various examples, you will come to know. So if you're interested, most welcome. Okay, now mini tab analysis. Why did I use? So there are 2 types of data. And just to train you into 2 types of data, let me use my video. So these are extra, those who have got a little time. So 2 types of data are there. One is known as continuous data and one is known as attribute data. Let's learn about them first.
Can you measure anything? There are two types of data, continuous data and attribute data. Continuous data can be represented on a number line. It can have a decimal place. It can also have a unit. Say, for example, age, height. Age is 52.5 years. That's my age.
Oh, that was my age 5 years ago. Sorry.
Height, maybe 180.1 centimeters. Cycle time of a process 3.5 hours, or procurement time in an organization 120.3 days.
So if you see, all of them have one thing in common. They have got units, yeah, and there is a possibility of a decimal point. Such data, we can create a histogram. Normal distribution is very much valid here, okay. But what about attribute data? Attribute data is something which we feel that we cannot measure. Typically, if you ask people, what can't you measure? They'll say, I cannot measure love, I cannot measure happiness, I cannot measure feelings. Well, you can. Let us see. How?
About attribute data. Attribute data can be expressed in categories, and categories can be counted. Say, for example, if you want to measure happiness, so easiest way to measure.
So why would you like to measure happiness? Maybe you like to improve the happiness of your employees, the staff members, your nurses, yeah. So you can measure using attribute data. And the simplest measure for any attribute is presence or absence of that particular attribute. So if it is happiness, I can say happy, unhappy, right?
Measure any attribute data is to create a category, and if possible, you can create a binary category. A presence or absence of that attribute can be one of the simplest categories. So if I take the example of happiness, two categories I can create: happy, unhappy. So if I want to increase the happiness in the employees in the organization, then I can always count how many employees are happy. Let's say 60 employees are happy and 40 employees are unhappy. I can express this as proportion. That means proportion of happy employees in my organization is 0.6 and proportion of unhappy employees is 0.4. And it can also be expressed as percentage. Now, this proportion.
So here, just to reiterate, see proportion, those who have forgotten maths, proportion means portion out of 1. So suppose the circle is 1, yeah. So 0.6 belongs to happy and 0.4 belongs to unhappy. We are habitual of percentage. If the circle is 100, then it will be 60 or 40, yeah. It could, yeah, we generally, but statistics never talks about percentage. It talks about, I'm talking about, high level statistics, not generic. We don't convert into percent. Cent means 100, right? We worry about out of 1. So that is why you'll learn, one proportion test, two proportion tests, in statistics. So depending on the data, type of data, you have to use the tool. So if you are having continuous data, you can make a histogram. But for attribute data, you will make pie chart or a bar chart. Yeah. Like happy, unhappy, very, very happy, okay, neutral, unhappy, and extremely unhappy. I cannot make a histogram there. I have to make a pie chart or I have to make a bar chart. So specific tool for every chart. Now, to answer that question, why did I use, when to use scatter and when to use box? So when you are trying to establish a correlation between two types of factors, yeah, two types of factors. One is continuous, one is attribute, or both are attribute, or one is both are continuous. So your tool will be based on that. So if I were to teach you very, let's say, well, I'm totally free. I've got a lot of time with me, so we can So let's say, let's talk about, mm, let's try to solve another problem. And so you have one more example. Can you tell me any one other issue in the hospital apart from patient discharge time? And here, let me. It will take another 10 to 15 minutes if you are willing to spend. Please do stay. Yeah. So tell me any one thing which you would like to improve in a hospital. Any other thing apart from patient discharge time. And then I'll tell you what do we mean by data-oriented approach. What do we mean by when we say, we only make our decision based on data, root cause analysis based on the data. So I'll be happy to. Yeah. So anything else? Yes, please. I would like to know. Have some inputs from you. Okay, completion of discharge summary. Okay, I think, thank you, Morgan. Thank you for that. Okay. Yeah. So anyone else? Yeah. No, we are not able to complete our discharge summary. So what I'll do, I would translate this into, just to make it a little simpler for everyone's understanding. We want to quickly finish our discharge summaries. And we are not able to finish because of, obviously, it takes time. So we can take up an improvement project to complete discharge summary within a specific time. So delay or, okay, discharge summary time. Yeah. Discharge summary time. Anyone else? I see only Morgan giving me a problem. Only others don't have any problem, right? Okay, let's go with this problem. Okay. So can you tell me some of the reasons? So this is our why. Yeah, this is our why. Can you tell me some of the reasons why our discharge summary, why we are taking too much of time, why we are not able to finish on time? Yeah, can you please tell me? And by the way, patient discharge summary time is the continuous data, right? If I were talking about patient errors in discharge summary, it would be attribute data, because error, no error. Remember that. Error, no error. Yeah. So it is continuous data. Tell me, what are the reasons of not finishing quickly? Just give me one or two reasons. Yeah, everyone can participate. Give your reasons. No, I don't think you are able to see. I don't think you are able to see each other's what others are writing. Yeah. So don't worry. Give wrong answers as well. Yeah. So yes, please. Okay. Lack of staff. Okay. Lack of staff. Training. Okay. Training. What else? Workload. Workload. Okay. What else? Number of patients. Number of patients. More patients, you are not able to finish on time. Anything else? Yep. Yes, most of the active people have now, yeah. So 20% of the people have left who are very active. Okay. So now let's take an example. Okay. So what I would do is, let's take two: training and let's say patients. Okay. Let's examine two. Now we say that we will not trust you or trust your reason till the time you prove using the data. So suppose you're telling that, training matters. So we have to collect the data. And just to take an example, this is discharge summary time. So I divide the staff members, or maybe, I go to the training department, I find people who got training for 10 hours, they finish writing the discharge summary on an average. If you take their timing, they finish in 20 minutes. Okay. I'm just taking a very, very simple example just to teach you a tool. Okay. Please understand. We are in the basic, we're in the foundational steps. So 10, if I train someone for 20 hours, they take 15 minutes. If I train them for 30 hours, they take 10 minutes. If I train them for 40 hours, they take 7 minutes. So the data is proving that training is impacting the discharge time taken to write the discharge summary. I've made it very simple. Okay, please understand. There are lots of factors in the Levy study, but so we'll say, yes, it does matter. But suppose I got a different type of data. Say, suppose this was not what I observed. 10 hours of training was given to someone and they took 20 minutes. Okay. 20 hours, he also took 30 minutes. 30 hours of training, he took maybe 10 minutes. 40 hours, they took, let's say, 25 minutes. In such situation, I'm observing there is no relation. I give 10 hours, even with 10 hours, another person, they were taking 10 minutes. Yeah. So with 10 hours, I'm getting 20 also. With 10 hours, I'm getting 50 also. So with 10 hours, I'm getting all kinds of readings. 20 hours also, all kinds of readings. Means there is no relationship. You train or don't train, there's no relation. Means root cause is somewhere else. Something else is causing. Okay. Okay. So let's say workload. Let's say high workload, low workload. So when if it's high workload, you are taking 20 minutes. When it is high workload, you are taking 30 minutes. When it is low workload, you are taking 10 minutes. High workload, 25 minutes. And low workload, 10. So workload is the root cause, not the training. Or if workload versus time you have taken, this one, then there is no relationship. So when you have got attribute data, this is attribute data, right? High workload, low workload. Yeah, high, low is attribute data. When you are trying to study the attribute versus continuous data, you will use a tool called box plot. And that's why, just to go back, we wanted to examine, if you remember. And there are other tools also, but I'm just focusing on these two. So when we wanted to study patient discharge time, is it impacted by patient discharge summary delay? Both are continuous. This is also continuous. This is also continuous. We used scatter diagram. Pharmacy time and discharge time, both are continuous. We use again scatter diagram. This shows it is impacting. This showed it is not impacting. Similarly, when we look at discharge time, reporting accuracy. If reports are told all accurate, less time. Reports are inaccurate, I take time to correct them. But staff availability, almost same or overlapping. Staff availability is not significant. And there are various ways of finding the significance using p-values. Obviously, I'm not going to go into that detail, but this is what we mean by saying that data-oriented approach. And when you make your decisions based on the data, you are less likely to fail. Yeah. So that's what Lean Six Sigma is all about. I hope you got some value out of this training program. And if you want, you can join my training programs. I run online training programs. I run face-to-face training programs. Feel free to write to me. You can also connect with me on LinkedIn. My LinkedIn profile, my profile will be given here. So you can connect with me on LinkedIn. I'll be happy to connect with you. If you send me the request today, I'll be happy to accept it because sorry, I did not tell this earlier. My team is going to really not like it because I should have told this earlier, half an hour ago. But yeah, those who are still there, you can connect with me on LinkedIn and do join the programs. Yeah, I hope I have motivated you enough. And thanks for attending the program. And yes.